Children from all over the world come to Cincinnati Children's Hospital Medical Center for this procedure. In this video, you'll meet members of our medical team as well as patients who've experienced the surgery. After you've viewed the video, you'll have a clear understanding of the steps as you prepare for surgery, recovery, and life with the urogenital Mitrafinoff. If you or a member of your family are considering undergoing surgery for a Mitrafinoff, you probably have many questions. It's our goal to answer these questions for you in the next few minutes. Throughout this video, you'll meet patients, nurses, and doctors who are familiar with the process. Their goal is to help you understand the procedures you'll need to prepare for and describe how you'll care for the Mitrafinoff, as well as give you a good understanding of what your life will be like following the surgery.
The surgery has really changed our lives because before Emily had the surgery, she was 3.5, had to wear a diaper with a maxi pad, and it drained all the time to that. After the surgery with the bladder reconstruction and the Mitrafinoff, we can cath her, she doesn't wear a diaper, she never leaks, she can go swimming, she can take showers, baths. We don't have any issues with the Mitrafinoff at all.
It actually is a reconstructive procedure where we use a child's own living tissues to create a tube, if you will. The device is the catheter, but the Mitrafinoff is a procedure that we use, and there's two components to that. One is that we create a living tube that will grow with the child.
Special children, special families. I guess the ones that really stand out in my mind are the ones that overcome their challenges in life and go on to pursue a successful life. And that's what's the most rewarding about this, is that we help these children achieving their goals in life.
A Mitrafinoff can offer convenience because catheterization can be done without undressing. For wheelchair-dependent patients, there is no need to be moved out of your chair. It also allows more independence in your care since catheterizations can be done without the help of others. Once the Mitrafinoff is healed and you have clearance from your doctor, you can return to normal activities that you enjoy, including swimming. Some individuals do prefer to cover the Mitrafinoff with a non-latex dressing while swimming. However, even that isn't necessary. Following the procedure, you'll be discharged from the hospital with tubes connected to drainage bags. Before you leave the hospital, you and your parents will learn how to care for these tubes.
Generally, 4 to 6 weeks after the surgery of having a Mitrafinoff created, there are tubes in place. The doctors will do a quick little procedure. It's called a cystoscopy, where they look inside the bladder. They make sure everything has healed up. If it looks good, they remove most of the tubes. And directly after the surgery, the child is admitted to the hospital, and that is when the teaching occurs of catheterizing the Mitrafinoff.
The main things that I remember about Logan's procedure is just the scariness of it, just not sure exactly what all it's going to be like afterwards, so it's that anticipation. But everybody at Children's was wonderful to calm your fears, help you through everything. They're there for any questions that you needed. And just going through it, seeing your child, you know, it's a tough time having to watch your child go through it, but you know it's going to benefit his life, and you know it's going to make him a better person, a more independent person.
Following this procedure, you'll be admitted to the hospital for a day, so our nurses can then teach you and your family how to catheterize the Mitrafinoff. Over the next few days, you'll practice catheterization with the support of the nursing team.
I'd like to maintain as clean an environment as is possible, and I think the success that we have here in doing that is by having the parents 100% invested from the beginning, and the parents teach their children, and they're responsible for showing their children the importance of hand washing and maintaining sterility when sterility is necessary, and maintaining cleanliness, and that, I think that's the success.
Before you catheterize the Mitrafinoff, you should first gather your supplies. Remember, the catheters come in different sizes and shapes, so your doctors and nurses will work with you to determine which catheter is best matched for your personal Mitrafinoff. One of the most important things to remember is that each time you catheterize, it is best to use a new catheter. If you use your catheter more than once, it's essential that it be cleaned in a special way in order for you to use it again. If there are any insurance issues related to your supplies, please call the urology office and ask to speak with one of the nurses. To help the catheter slide through the tunnel of Mitrafinoff and into the bladder, be certain to use lubricating jelly. Using a water-based medical lubricating jelly is essential every time you catheterize. Don't forget that it's crucial to remember to use antiseptic wipes or swabs to clean the skin around the Mitrafinoff. Standard cleansing wipes, betadine swabs, or BZK wipes should be on your must-have list. Placing your supplies on a clean surface is the last and very important step. A paper towel is always a great option.
It's really helped me be a kid because I can be more independent. Like, if I want to go to a friend's house, Mom doesn't need to stay there to help me every time I need to go cath in the restroom. I have everything I need, and I can just leave for a second, go and do the process, and then be back in less than 5 minutes. So it's just helped me be a lot more independent.
So as we start to review how you'll be doing the actual catheterization, we're going to walk you through some very important steps. Hand washing is important both before and after catheterization. At home, we recommend you use liquid soap and water, while away from home, a hand sanitizer can be used. Don't skimp on the hand washing process. Rub your hands for at least 20 to 30 seconds, covering both the front and back of your hands. A simple timing system is to sing your ABCs, then be certain to dry your hands with a clean towel or paper towel.
Well, we can't stress strongly enough how important it is to just simply wash the hands and wash them properly. We understand that sometimes this is a process that gets shortchanged. However, I think if the parents stress to the children how important this is, it does really decrease their chances of infection and getting sick.
It's made my life easier because I don't have to take my clothes off. I can go anywhere with a cath, like in my purse or something, and go to sleepovers pretty much. And Mom doesn't have to be there with me because I can do it by myself and I can cath by myself, and that's pretty much it.
The comfort level is a lot better because I had to get undressed and everything, and now all I have to do is just pull my shirt up 2 inches and I'm able to do the process.
After this step is complete, open the cleansing wipes or swabs along with the lubricating jelly and the package the catheter is in. Squeeze the lubricant into the inside of the catheter package. If your doctor has instructed you to wear gloves or you choose to wear gloves, now is the time to put them on. Wipe the skin around the Mitrafinoff with the antiseptic wipe. You'll want to start at the center of the Mitrafinoff and wipe in a circle moving away from the opening. It is crucial that you repeat this process 2 or more times. Now, just pick up the catheter with your writing hand. As a special precaution, do your best not to touch the tip of the catheter with your hands or any other surface unless it's been sterilized. Next, roll the tip of the catheter in the lubricant so it covers the first 1 to 2 inches of the catheter. Depending on what is most comfortable for you, you can sit or stand as you catheterize your bladder. Insert the catheter into the stoma. Remember, it's normal for you to feel a pop as the catheter passes into the bladder. Again, this is normal. Once the urine stops flowing, simply pull the catheter out just a bit so you can see if any more urine needs to drain. Then, when you're certain it's stopped, remove the catheter and wipe the skin around the stoma with a wet washcloth or baby wipe to remove the harsh cleansing fluid from your skin. If you don't remove the fluid, it can become sore and break down. And now it's so important to remember the final step. Wash your hands one last time. Follow these steps every time you catheterize, and you will keep your bladder very happy. Everyone who has a Mitrafinoff has to remember to irrigate the bladder. The goal is to make certain we remove the mucus that is left sitting in the bladder. Mucus can be irritating and cause infections that result in bladder stones. Just like the other procedures we've talked about in the video, supplies are important. For this particular process, you'll need a catheter, tip syringe, and sterile normal saline. You can easily pick up sterile normal saline from your pharmacy. However, you will need a prescription. Before you catheterize your bladder, draw normal saline and place the cap back on the syringe. Before you catheterize your bladder, draw normal saline and place the cap back on the syringe. Catheterize your bladder. Once the urine is drained, insert the syringe into the opening of the catheter. Gently push the normal saline into the catheter. Be certain that you're drawing the right amount according to your doctor's instructions. When you disconnect the syringe, you will fold the catheter in half, so the saline will remain in the bladder while you're drawing more saline into the syringe. Once the total amount of saline is in the bladder, you can gently pull the plunger out to remove the saline and mucus. Do this until you meet resistance, or you can no longer remove any more fluid. Be aware of the possibility of mucus clogging the catheter. It can cause you to pull more fluid out of the bladder than was put in and prevent urine from draining.
The goal, of course, is to create a system that doesn't need antibiotics, but certain children will maintain a need for long-term or short-term antibiotics. And generally, we found that with good irrigation, with maintenance of cleanliness with catheterization, and cathing on schedule, the infection risk is much lower.
We do use an antibiotic directly in the bladder. It's called gentamicin. Generally, we use that to prevent infections, to decrease inflammation in the bladder. It's a simple procedure.
The gentamicin is mixed by a special pharmacy and delivered directly to your home. It should be prepared in individual syringes. Place 3 syringes in the refrigerator and store the remaining syringes in the freezer. An hour before the last catheterization of the day, take a syringe from the refrigerator and place it on the counter to allow it to warm up. Take another syringe from the freezer and place it in the refrigerator to thaw in preparation for the next day. The gentamicin will need to be transferred into a catheter-tip syringe before you catheterize. Do this by pushing the shorter tip syringe into the longer tip syringe. Once you connect, push the medication into the empty syringe and place the cap on until you're ready to use. Catheterize and empty the urine from the bladder. Attach the syringe containing the medication to the catheter. Gently push the medication into the catheter. After the medication is in the bladder, keep the syringe attached to the catheter and then remove the catheter from the Mitrafinoff. The medication should stay in your bladder overnight.
We have doctors on call during non-office hours and also on weekends. So if there's a problem during office hours, you can contact one of the nurses. After hours, there are doctors on call that can help you with any problems or concerns that might come up at that time. We actually encourage people to call.
If you have trouble getting a catheter in, first try a new catheter. If it still will not go in, then try changing the position of the catheter. Sometimes just turning the catheter can help. Try lying down or lying on your side. If you're still having difficulty getting a catheter in, you can still catheterize your urethra. Do this and simply empty some of the urine from your bladder. Then try again to catheterize the Mitrafinoff if you have a bladder neck procedure or can't catheterize your urethra. When the bladder is too full, it can make it difficult to get the catheter into the bladder. Saline irrigation will not drain from the bladder. As you pull the plunger back from the syringe, the saline irrigation should drain from the bladder. When it doesn't, it means that the tip of the catheter may be laying against the wall of the bladder. Try repositioning the catheter by either pushing it in or pulling it out a little. Then try pulling the saline out of the bladder again. If this doesn't work, disconnect the syringe from the catheter. Gravity will then help it drain. If the saline still doesn't drain from the bladder, it means that there may be mucus clogging the opening of the catheter. Try adding about 15 milliliters of saline and pulling it out again. Smelly urine can be caused by foods that we eat or by not drinking enough fluids. If this is happening, up your intake of fluids. If this occurs along with other symptoms or a urinary tract infection, you will need to call our office. Here are some notes that will guide you on when to call. If you have a difficult time getting the catheter in the bladder and the problem-solving tips haven't helped. If it feels like the Mitrafinoff is getting tight or the catheter does not pass through the Mitrafinoff as it had previously. If there is any blood on the catheter. If you're having symptoms of a urinary tract infection. Leaking from either the Mitrafinoff or from the urethra. Pain with catheterization. Fever not caused by a cold, throat, or ear infection. Abdominal pain. Blood in the urine. If you cannot insert the catheter at all, this is an emergency. Call the urology office or the urology doctor on call immediately. The doctors and nurses at Cincinnati Children's Hospital pride themselves in making this the most comfortable experience that we can. We work as a team alongside your family every step of the way. The Mitrafinoff should make your life easier and more comfortable. We're here to help you with the surgery, the recovery, and the transition to regular use of the Mitrafinoff. And we're only a phone call or office visit away if you have any concerns or questions.
I feel very privileged to be a pediatric urologist in this day and age where so many giants have come before us and opened up doors for treatments, and smart people have made observations and innovations that I can then apply to my patients and get the results that we're getting.
Okay, you don't even have to ask it. Okay, okay. The support and the experience at Children's Hospital has been phenomenal for us. They make you feel so part of their family. And when you're going through this and in the situation where you have a sick child or you have a child who's scared, that piece is something that you can't put a price tag on. And knowing that they call your child by name, they remember him, he's not just one in a million, goes a long way. And just knowing that we can get the support 24/7, they call you back immediately. It's not like they just put you off and, oh, we'll get you the help, because they know you're concerned, because your child's your everything. And it's just been a great experience for our family.